A few things to note. We are not medical professionals, and all our information comes from lived experiences and trust sources. When we say women or woman, we refer to people born with female anatomy. It is completely possible for a trans male to have endometriosis if he was born with female anatomy, even if those female parts have now been removed. We are voluntary, we don't get paid for running the hub, and we volunteer our time. So, the bare basics of endometriosis are that 1 in 10 women have a diagnosis of endometriosis in the UK. The definition of endo is often misunderstood, and the wording is very important. So, women have a diagnosis of endometriosis. It doesn't mean there are not a massive portion of women on the planet who are experiencing symptoms but are not yet diagnosed. The tissue is similar to the lining of the womb, but not the same as, and this then grows outside of the uterus, most commonly in the pelvic cavity, but it can be out with, which we'll come on to later. These sticky patches can then lead to organ damage, organ loss, adhesions, bloating, inflammation, chronic pain, and a whole host of other problems. Endometriosis cells thrive on estrogen, which is a hormone, which is why progesterone therapies are often used to control growth. Here are a few of our most commonly misunderstood myths. So, all periods are painful, and that is completely normal. Heavy periods, painful periods are not normal. If you have periods that are excessively heavy and disrupt your daily life, or if they're so painful you can't do normal things like drive, go to school, then you definitely need to speak to a doctor. Endometriosis can affect a woman from pre-puberty to post-menopause, and it's not uncommon for symptoms to start around about the age of 11 or 12. Hysterectomy or pregnancy is not a cure. Unfortunately, endometriosis does not currently have a cure. There are treatments and there are managements, but there are definitely no actual cures. So, hysterectomy with or without ovary removal is often performed to remove scarring, reduce the inflammation in the pelvis, and slow down hormone production. But it is most certainly not a cure. And you can have endometriosis after having a hysterectomy, although there are high success rates within the endometriosis symptoms settling after having a hysterectomy. You also do not have to be having active period bleeds to have endometriosis tissue and experience symptoms. Endo has been found in every organ of the body and is an all-body disease. Because the tissue is not exactly the same, although it does bleed and shed in a similar way to the endometrium, which is the lining of your womb, it's not the same. So you can have endometriosis and you can have endometriosis symptoms without also having a period bleed. So as we've said before, endo is not just a bad period, which is what the media has portrayed it as for quite a long time up until recently. There's a lot of signs and symptoms. I've listed them here, but we also have a whole host of others which can affect your daily life, including sore joints, fatigue, and a general feeling of unwell, things like dizziness and other associated conditions, like low blood sugar, low blood pressure, and things like that. Because it's a hormonal condition at its core and it's dictated by your hormones, a lot of these things are down to the hormonal imbalance rather than the endometriosis itself, but having endometriosis certainly doesn't help. If you're having any of these symptoms, even if there's just one and it's affecting your life, please do hop over to our website. We have a printable resource where you can there's a tick sheet with all these different symptoms on, and a section that you can put in your pain score and your notes that you want to speak to the doctor about. Print it out, take it along with you to your appointment, and it makes a big difference when you're trying to advocate for yourself. So diagnosis is still way slower than it should be right across the world, and this makes it really important to get any symptoms you're experiencing checked out as soon as possible. Even if you have symptoms that have been occurring for a long time, if it's unexplained, then keep pushing for answers. Part of the delay is down to symptoms overlapping with other conditions like IBS. There is also a myth that the condition is rare, so it's not at the very front of a list of options to look into often. We are only very recently been given doctors a permission, like doctors have been allowed to start non-surgical diagnosis of endometriosis. So the 100% gold standard diagnosis is still through keyhole surgery, but you can now have treatment started based on endometriosis-like tissue seen on scans, and also if you tick enough of the symptom boxes. But it's a very complicated process, and without the actual surgery, you won't get the diagnosis in black and white, as it were. To help you with your doctor's appointment, as I said before, we do have our printable sheet. This is it just here. Hop over to the website and have a wee print of that, and it's really, really useful to have. Please also be aware this is something that's maybe not spoken about quite as much. When you're speaking to doctors, please mention if any of your biological relatives have endometriosis. This makes you much more likely to have the condition. Mother-daughter relationships, if your mother has endometriosis, you are 6 times more likely to experience the symptoms and have endometriosis. So it doesn't mean you'll definitely get it by any means, but just bear that in mind if you're having some of the symptoms that I've talked about before. Now, you may have seen people talking about endometriosis grading, saying, oh, I'm a grade 3 or I'm grade 4. So this is not severity of pain. Please don't misunderstand that. You can have endometriosis grade 1 and be in agony all day, every day. And then women have been found to have endometriosis stage 4 while having a C-section. They never knew. They didn't have any problems. They had no pain. This is purely a surgical anatomy-based decision. So this is how much damage the endometriosis has done to your body. So stage 1 and 2 are known as superficial endometriosis. So this is where lesions are on the membrane that lines your abdomen, the bag that holds all your organs together. Cysts and visible lesions of endometriosis and organs starting to be fused together then tips you into grade 2. Grade 3 often involves multiple organs within the pelvic cavity, things like your ovaries, whether it attaches to the bowel, the bladder, and there's quite often hefty, extensive adhesions. So adhesions are where you're sort of, it's like the best way to describe it is almost like when you were a child and you painted your hands with PVA glue and you stuck them together. And then when you pulled them apart again, there was this kind of filmy web-like stuff that came in between. That is the best way I can describe adhesions. They shouldn't be there, and they don't fuse as such your organs, but they do restrain the things that they're attached to. So if your ovary is adhered to your bowel or your pelvic wall, then it's not going to be able to float around the way that it should do naturally. And this can cause a whole host of problems, and it's very, very unique to the person and the adhesions that they have. Then grade 4, which is quite often known as DIE, which is deep infiltrating endometriosis. This is where organs are affected outside of the pelvic cavity and within. And if they're affected just within, it does tend to be very, very severe. It infiltrates, which means it has pushed through the bowel cavity. You could end up with an appendix removal. You can have it on your diaphragm, near your lungs, your heart. It's a very, very surgically serious level of endometriosis. But like I said before, that can easily be grade 4, lots and lots of physical damage, but you have very little pain compared to someone with stage 1. So we don't really know why yet that causes that discrepancy between pain management. But just because you have endometriosis grade 1 does not mean that you're in any less pain than someone with endometriosis grade 4. So the treatment and management options. I personally hate the term treatment for endo because there is no cure, and the more we say treatment, the more it makes people think that you have been treated. There is an end point to this. And at the moment, we don't have a treatment. There are lots of great teams working on this, but right now there is nothing at the moment. So I've included the term management as well. I think it's a bit more well-rounded, and it is a condition that you can manage. The aim of the game is to control hormone levels, slowing down the endometriosis lesions and the growth of the tissue. If endo has caused damage internally, then surgery is often needed to repair this. And as I said before, adhesions are bands of scar tissue that form between organs and tissues. Think of them as internal scar tissue after surgeries. These don't happen to everyone, but if they do, they cause pain, inflammation, and organ dysfunction. Something that is tricky to speak about because a lot of people are wary of it are things like holistic therapies such as acupuncture, heat therapy, massage. There's a very big push in the last 10 years on surgery, but coming from a patient standpoint, we can't advocate enough for things like heat therapy, deep tissue massage. They are certainly not going to cure you, but working with a really good pelvic physiotherapist, having a good acupuncturist, all of these things can work together with the medical side of things. There's no reason why you can't also have hormonal, hormonal input and surgeries and all of these things, as well as also doing the things that make you feel good and make you feel better. Things especially like deep tissue massage help with sleep, they help with flexibility. All of those things make you feel better in the general sense of feeling better, not necessarily changing the endometriosis tissue, but it will make you feel well in yourself, which is a big part of the battle. Okay, so let's say you've got your diagnosis. Now what? It's baffling. It's a sea of information on Google, and your doctors don't even seem to be saying the same things. If this sounds familiar, you're definitely not alone. So bear in mind that endometriosis is an all-body condition. It is not a bad period, and it's certainly not just a uterus condition. Please don't put off going to the doctor for things like breathing problems, headaches, aching joints, basically anything that is a sudden change or new for you. Endo does not automatically mean being infertile, although it can decrease your fertility depending on the depth and severity of your disease. As we spoke about in a couple of previous slides, anything with deep infiltrating endometriosis can be quite limiting when it comes to fertility. Totally depends on the area where the damage is and the organs that are involved. If you've had any previous miscarriages or if you have any other medical conditions that might impact this. Please speak to your doctor about pain management. There are lots of different things that you can try, topical things, patches, gels, as well as your usual kind of tablets and routes like that. Please speak to your employer about your needs. Make sure that they know what you need. They can help you make your adjustments and make work much more accessible to you. Thankfully, a lot of workplaces will let you work from home now, and if that is an option, it might be best for you to discuss that with them. Flare-ups are very, very unpredictable, and it's good to know that you can be at home if you need to. There is that flexibility. As I said before, lifestyle changes, and no, it's not all yoga and kale and sitting around in your sandals. Even if you can do something for yourself once a day to make your heart feel lighter and make your head feel less heavy, that's always a step forward. And join a local support group for peer support. Obviously, we're biased here. This is what we do. But we want to be clear that support groups are not all about sitting around crying with a cold cup of tea and a sad boredom biscuit in a town hall. They are vibrant communities of incredible women, both online and in real life. The community is there for swapping advice, talking about different tips and hints and tricks, laughing and holding each other up when we have those really bad days. So we are based in Scotland, but there are so many others. So all of the different support groups in Scotland, which we're very, very lucky to have a wealth of, they are all run by volunteers who are all endometriosis patients themselves. So please hop over to our website. There's links to every single one of these groups. And if you can share that link on your social media, we'd be ever so grateful. It means that anyone in Scotland who might need to access these communities can do. That was a very, very short recap of the basics of endometriosis. Thank you for listening, And don't forget to hop over to our website for the printable resources, including symptom checklists and how to get your best from your doctor's appointment. These are absolutely free. Just right click on them and press print.